Hello, I'm Dr. Vijay Shetty, an eye specialist and also a glaucoma specialist. I've been practicing glaucoma for last 17 years. I have a huge experience of seeing thousands of glaucoma patients as well as doing hundreds of glaucoma surgeries. I perform all types of glaucoma surgeries, which includes trabeculectomy and minimally invasive glaucoma surgeries like high frequency deep sclerotomy and eye stent surgeries. Glaucoma is a condition wherein the optic nerve is damaged because of high pressures in the eye. The normal pressure in the eye is between 10 to 20 mm of mercury. Because of various reasons, the pressure may go above 20 mm of mercury. Then the optic nerve gets damaged slowly over a period of time, which leads to vision loss mainly on the sides or in the peripheral vision in the beginning, which advances towards the center in the later stages. So it is difficult for the patient to realize that he has some problem early in the disease. So it is important for all the persons above the age of 40 to get their eyes screened for glaucoma. The screening for glaucoma includes eye pressure examination by an eye specialist and optic nerve examination, which is done under slit lamp by a microscope. There are two types of glaucoma, the open angle glaucoma and closed angle glaucoma, which are made out by examination of the eye. So both open angle glaucoma and closed angle glaucoma are more common if you have a family history of a certain type of glaucoma. Unfortunately, there are no major symptoms for glaucoma in most of the cases, except for very few cases which can present with redness, pain and blurred vision. In most of the cases, glaucoma diagnosis is done when he visits an eye specialist for other reasons. This is because the vision loss in glaucoma is in the periphery, which is not appreciated by the patient. So the patient will come to know about the vision loss in glaucoma only when 70 to 80% of the vision is lost and it starts affecting the central vision. So hence it is very important for any person above the age of 40 to visit hospitals every year to check the eye pressure as well as undergo a routine comprehensive eye examination. There are various reasons for glaucoma, but most commonly it is the advancing age. The incidence or the chances of having glaucoma after the age of 40 is 1%, that is 1 in 100 above the age of 40 years have glaucoma, and which increases with age. So around 2% above the age of 50 and 3% above the age of 60 have glaucoma. So age is the most common cause of glaucoma. Other than that, there could be other reasons for glaucoma, which includes injury to the eye or some other disease of the eye, especially diabetic retinopathy, which can cause secondary glaucoma. Diagnosis of glaucoma at early stage is difficult unless your eye specialist examines your eye completely. Normally the pressure is between 10 to 20 mm of mercury and it varies at different times of the day. If the pressure recorded at any time is more than 20 mm of mercury, then your eye specialist suspects that you for having glaucoma. Then a detailed examination is required to make out whether you have glaucoma or not. Pressure more than 20 alone is not enough to diagnose glaucoma. It only gives us a suspicion that you might have glaucoma. So further examination like the examination of the angle, optic nerve examination and special test, we call it field of vision, which is wherein the peripheral vision or the side vision is checked, and the scan of the optic nerve, which is called optical coherence tomography of the optic nerve head. These tests help us in diagnosing early glaucoma. Glaucoma, as I said, is an optic nerve damage because of the increase in pressure. The optic nerve damage can be prevented by controlling the pressure. However, the optic nerve damage once happened cannot be reversed, but it can be arrested at any stage of the disease. So early diagnosis of glaucoma is very important, to preserve the vision for lifetime. Optic nerve is a nerve which carries the signals from the eye to the brain. So these normally contains around 10 lakh fibers, which reduces normally with age. However, in glaucoma, there is a rapid loss of nerve fibers leading to optic nerve weakness. Hence, the optic nerve carries less signals to the brain. Therefore, initially the side vision gets affected and then the central vision gets affected. If you have a family history of glaucoma, that means like first degree relative of yours have glaucoma, there is around 3 to 4 times increased risk of having glaucoma. For example, a person over the age of 40 carries a general risk of having glaucoma of 1%. But if he has a family history of glaucoma, then the risk is around 3 to 4% for the same age group. And the risk of glaucoma increases with age. It is advisable to get your eye examined routinely for glaucoma screening after the age of 40. It is not necessary to wait for glaucoma screening till you get symptoms, because by the time you get the symptoms, as I said, you would have lost around 70 to 80% of the vision. So it is, as it is a preventable disease, it is very important to diagnose glaucoma at an early stage. So it is important to get your eyes screened once a year after the age of 40, and more so if you have a family history of glaucoma. Currently, I am working in Sri Ramakrishna Netralaya, Vashi. Previously, I was working in Lakshmi Eye Institute, Panvel from 2006 to 2022 as Deputy Director Cataract Services and Glaucoma Specialist. In order to book an appointment, please call on the numbers mentioned below at Sri Ramakrishna Netralaya at Vashi branch. I will be available from 11 o'clock in the morning to 7 o'clock in the evening.